Hi, I'm Dr. Richard Amy. Many of you know me as the Laser Doc. So Jenna is going to help us out here, and I'm going to do just neuromuscular pain syndromes and help you to understand that because I've changed it over the year based upon the software changes and what we've learned. So I put all the frequencies for neuromuscular pain syndromes into one, which is called chronic pain. Chronic pain works for nerve pain, muscle pain, joint pain, vascular pain. It has muscles and tendons and ligaments, so it's a very robust setting. And so we're going to use one setting instead of using chronic pain. And in the past, we used to use muscle. I just brought the muscle balance ones into this particular setting. So you know my mantra, I always like to laser the nerve first, the nerve to the area, the affected area, and then we like to do movements. So I just want to go through real basically what we're going to do, whether using the LZ30Z laser with chronic pain or the Revi. Both work the same for the most part. The infrared's a little bit more analgesic, so if you're doing pain syndromes, I have a tendency to lean towards the Z. If you're doing it, you can still use the Revi. The Revi has a lot of power in that violet, even though we're not going as high as far as the milliwatts that we're producing. It's still producing a lot of photons. So the key is when we're shooting photons in the body, they need to be absorbed. If they don't get absorbed, it doesn't do us any good. When that photon hits the receptor, right, in the mitochondria, it gives all its energy up, and that creates ATP, which is the gasoline for the cell, helps the pain go down, helps the nerves to regenerate and the muscles to relax. And when that happens, we see increases in range of motion and muscle strength, which is the key, because most of the time you don't feel the laser. Have you felt the laser in the things we've been doing? So most of the time you don't. So again, I want to show difference in strength than the other. But real basically, we just want to come into the nerve for the neck. So I'm going to actually have you help me a little bit as we go through this. And so I'm going to have you put this laser right there. I could also put the laser in back with the stand. I can put it directly on the skin, or I can put it away from the skin. So there's a lot of different ways that you can do it based upon your practice and what you're trying to do. When we're doing the neck, I like to do multiple ones, and if I could do only one spot in the whole world for pain, where would it be? It would be right here. I'm coming through the anterior cervical spine. That peripheral nerve is carrying information through the vagus nerve, which is right next to it, into the brainstem, and the brainstem in the lower part in the pons and medulla is where the pain inhibitory centers are. There's only three, two in the brainstem and one along the dorsal horns of the spinal cord. So anyone with phantom pain or anything like that, I'm going to laser here. Now I have it set to beep every minute, but we're not going to go through the whole thing. So where would the other places I want to be? I'm trying to go directly to the spine. Let's say she had more pain on the right side of her neck. I still want to do this spot right here. I'll take that from you now. And we're going to come into here. I got it. That's fine. And then we're going to come to two places in the back. Okay? So we're going to come into the back here, and then we're going to come there. Now, I have both of these trapezius, right, put in the book. When you look at it through the manual, you're going to look at chronic pain, only the chronic pain. You're just going to double the time. So if she was predominantly more on the right, I might spend more times there. Again, this is a stepping off point. I can come in now. Once I hit the nerves, I can come into a much bigger area, and I can sweep that. So I can come in and I can sweep this area. One of the other things I like to do while I'm lasering is to have them doing motions. So if you wouldn't mind tipping your head to the right for a little bit, and then maybe stretching it with your other hand. There we go. Stretch it a little bit, and then come back the other way. Good. Stretch that a little bit. So lasering through motion. Now, a lot of people say, hey, wouldn't it just stretch out? I tell you what, I know it doesn't get better because this is what I did on my first clinical trial to try to get it approved in the United States on neck and shoulder pain. And believe me, when you have a placebo laser, they get worse many times. So people say, oh, if you just stretch it, it'll feel better. No, that's not necessarily the case. Okay, let that relax. Then I might have them do some little figure eights with their nose, sort of watching me just 5 one way and 5 the other. So very simple. Always treat the nerve, treat the affected area. If it's going down one area, then you're going to continue on. Now, everything is just a continuation for me. So if I'm going to do the shoulder, let's say on the right side, where am I going to go? I'm going to laser right here in the neck first, probably come posterior. Now I have points in the book that are where nerves are or trigger points, okay? I could have this on the stand. I can be lasering from far. I could be using a percussion instrument. I could just be coming in here with my thumb and releasing this trigger point. It doesn't necessarily have to be going, right? It doesn't have to be right directly on the skin is what I'm trying to tell you. It can be further apart, okay? So again, using the laser is great. You can use it far away on the stand. I recommend using the span because it's so easy. When we come back down, we want to do the elbow. Where are we going to start? We're going to start at the higher centers. We're always going to look at the joint above, and then sometimes we look at the joint below, but most of the time, 90% of the time, I'm going to be looking at the joint above. So what are we going to do? We're going to come back in. We're going to laser that area in the neck first. We're going to come in the shoulder, and then we're going to do movement. So why don't you keep your arm straight, and then just bring it up for me. Good. And then bring it back. Bring it back as far as you can. You're going to have to bend that elbow a little bit. Good. Stretch it out. Nice. Then bring it over. So again, these are simple things that you can do while you're lasering, and it's really not hard to train a patient. Usually they get pretty good at this after 1 or 2 visits. Same thing when we're doing the wrist. We're going to start high, look at the nerve entrapments, and we're going to do both the elbow, right? We're going to come in here. Lots of times we're going to have things going on the lateral portion, right? So this is tennis elbow. The medial portion is bowlers, right? Bowling and golfing. So medial and lateral. And then we come to the wrist. We're just going to be a continuation into the wrist and throughout it. So neuromuscular pain syndromes, I start off with about a 6-minute protocol. You can go longer. If you still want to go another 3-4 minutes in the area that's the most pain. But do a little bit of motion. Get some work going in there. Shrug your shoulders. Bring your shoulders up for me. Continue to laser. Turn your head. Same time. This is a nice trick for coming back there. So it's not complicated. I want you to be able to follow it. Most of the time, your assistants can do this. Your team members can do it. The doctor doesn't have to do it. I like to do a lot because I do a lot of neurological sort of little tricks that help them get better faster. But in a situation, you can put it on skin, you can back it away from skin. Always treat the nerve, always look at the joint above, and then laser the area, and you can continue for longer periods of time if you think necessary. So that's the upper extremity neuromuscular pain syndromes using the chronic pain setting. You can find that in the essentials or in the favorites file.